立法會主
The President. Good morning. We'll continue with the motion debate on reviewing Hong Kong's mental health policy. Mr. Martin Liao. Thank you. I thank Ms. Lam So-wai for moving the motion. We have now a greater demand for mental health services. In 2022-23, the HA's figures are that we have over 967,000 psychiatric patients. It is a significant increase from before. For new stable cases, the longest waiting time is 99 weeks. The situation is less than ideal. The government must review its mental health policy. We need to deal with first the manpower issue. We right now only have 385 psychiatrists. Their average consultation time is 5 minutes. They can't fully grasp the situation of patients in that short time. The manpower shortage cannot be resolved in a short period of time. So apart from looking into recruiting more talents, we should have public-private partnership. With the public-private partnership program of the HA, the patients can go to private doctors for 10 consultations. And they must meet certain criteria in relation to clinical signs, and they need to receive treatment 12 months before. As there is an increasing number of patients, I suggest the government relaxing the threshold. Some people may need more than 10 consultations. So I ask the government to subsidize more consultations in order to alleviate the burden on the public healthcare system. Right now, there are 40 private psychiatrists participating in this scheme, but there are certain criteria with the patients, and there are a number of psychiatrists that have yet to participate in the scheme. I hope the government can get a better understanding of why these doctors are not participating in the scheme. We also need to look at the private professional development of psychiatrists. We need to provide more counseling to those in need, and we do not have enough counseling professionals. We do not have professional accreditation for counselors at the moment. So I suggest the government set up an accreditation framework for counselors to encourage more organizations to hire counselors to provide counseling services to those in need. We need to prevent any further tragedies from happening. And according to a survey last year, about 60% of the patients have moderate to severe depression, and they are not seeking help because they think they would not get the help they need. So I suggest the government enhance promotion to reach out to these hidden cases. At the end of last year, we have the 18111 hotline for mental health support. On average, we have over 300 inquiries. We need to have more volunteers to man the hotline in order to provide assistance to those in need. As the WHO said, without good mental health, one is not healthy. And with a number of psychiatric patients that are not treated, it will eventually cost the society. So I speak in support of the motion and amendments. Dr. So Chen-wing. 1 year ago, there was the Diamond Hill stabbing. That left a long-lasting impression on us. This issue has caused great public concern. We also have concerns about student suicides. In 2020-23 school year, students who have expressed suicidal thoughts or have attempted suicides, the percentage is 4.1%. It is a record high in 5 years. That's why for different age groups, it is important to provide mental health support for them. I agree with what Ms. Lam So-wai said, that we should review the mental health policy, and I also speak in support of the amendments. We had the mental health review report published in 2017. 40 recommendations were made to improve the mental health services of Hong Kong. It has now been 6 years. But I understand that 18 recommendations have yet to be implemented. For the recommendations that have been implemented, they are not so effective. For example, for the case manager ratio, it is said to be 1 to 40 now. But case managers have very short meetings with patients. And the case managers are not conducting home visits as they should. So the quality of the service, in fact, has suffered a decrease. And for the new stable cases, they need to wait 99 weeks to get specialist outpatient services. These patients are essentially trapped in their disturbing world. With the shortage of resources in the public healthcare system, we're essentially causing the worsening of the condition of the patients. So I have a few suggestions to make. We have 3 mental health surveys done in 2023. We should target the mental health needs of different age groups and formulate comprehensive mental health support policies. We should also flesh out the district health network to provide early intervention and support to those in need. We should make good use of the district health centers and care teams to provide more psychiatric outreach services. We should also enhance the PPP program and increase the number of places for psychiatric services to ensure those in need can get referrals as soon as possible. We should also make good use of AI and big data to conduct analyses. We should make use of these methods to identify early on the cases in need. We should also predict the needs for hospital beds and services with such analyses to formulate comprehensive plans for future services. We should also make sure there is a clear career path for the progression of relevant professionals. We should also flesh out the 3-tiered emergency mechanism, provide training to the relevant personnel, and make sure the services can cover also primary school students. We should make sure the gatekeeper role of relevant professionals can be fleshed out. I so submit, President, Mr. Ring Kong. I thank Ms. Lam So-wai for moving the motion and other members for proposing amendments for us to discuss this issue. In recent years, we have seen a worsening situation in Hong Kong. According to a study of an association of psychology in Hong Kong, we have suffered a worsening situation in relation to depression. And according to the 2023 Vitality Index released by a company for the 4th consecutive year, we are ranking in the bottom. And 87% of the locals in Hong Kong said they have suffered great pressure. It is a figure higher than the rest of the world. And in fact, according to a KWOK study, between 2019 and 2023, 24% of children and adolescents, when interviewed, have expressed that they have had at least one mental health disorder, and 1/5 of elderly persons have dementia, and 8.6% have depression and anxiety disorder. These figures show that there is much need for a review of mental health policy. Society perception has shown a great demand for psychiatric services. We can also see the waiting time being so long would reflect that there are inadequate services. From April 2023 to March 2024, the average waiting time is 38.7 weeks. Compared to the rest of the world, this is a very long waiting time, according to the Ministry of Health in Singapore's figures. For public psychiatric outpatient services, people would only have to wait 4 weeks. And according to the NHS UK figures in 2023-24, the first time people are taking speech therapy and other kinds of therapy, people would only have to wait for 3 weeks. According to the HA figures, as at end 2022, we have 293,000 psychiatric patients, but we only have 385 psychiatrists. The ratio is 1 to 761. And the ratio for certain disorders may get even worse, resulting in a long waiting time, and patient's condition may worsen during that period of time. It is a vicious cycle. PPP program is just a band-aid approach. In the long run, we need to have a fund to recruit more talents from the mainland and increase the number of training places to provide more financial incentives to retain talents. We should also have more ICCMWs. We should also increase manpower supply of other professionals such as case managers, nurses, as well as counselors. In relation to delivery of services, we can make use of technologies. We are lagging behind in this regard. For digital mental health, we can make use of chatbots, social media, etc. for diagnostics. For example, in Denmark in 2014, that digital health center has set up a digital clinic with online video diagnosis. They can provide both diagnosis and treatment services for psychiatric patients, thus shortening the waiting time. Lastly, according to a WHO framework, it is said that there are 3 goals. We have to be people-oriented, improve health, and provide protection for people. When we are reviewing Hong Kong's mental health policy, we need to allocate more resources to meet the needs of different people. We should also especially consider those who are in the grassroots to ensure there is fairness. I so submit.
Ms. Chen Hao-Yen. Thank you, President. When it comes to mental health policy, it is something that is very difficult. According to information, over 500 cases of suicide or attempted suicide have been recorded. That means, on average, 3 a day. So, our society is facing a very big challenge when it comes to mental health of the population. I understand the government has made a lot of efforts, but because of problems, it's difficult to yield instant results. I'd like to give some suggestions for the government's consideration so that we can further enhance mental health policies and support for those in need. The first suggestion is that we should devise community-based policies, or to be exact, we need to differentiate psychological and mental problems from physical problems. For physical problems, there may be some physical signs such as pains and other symptoms that a patient may wish to seek help. Whereas for mental problems, not many people are aware of the severity of mental health problems, and that is why we need to reach out at district health centers or community living rooms, street booths. Staff should proactively reach out and talk to members of the public to ensure their mental well-being, especially the vulnerable groups such as the chronically ill, the old, and women. We need to instill positivity in the population. Apart from preventing them from developing mental illnesses, we can also help groom them to become gatekeepers for the mental well-being of their families, so as to reduce the number of mentally ill persons in our population. Now that we're in dire straits, we must not sit on our hands and wait for patients to come to us. That means we should not allow patients to wait in the long queue before mental health services are delivered to them, because this will exacerbate the situation. However, we also face the constraint of manpower shortage. According to manpower projections, psychiatric nurse will still be in the shortage. By 2025, we will be short of 320 nurses, and the situation will only improve until 2030. According to information, there are 460 psychiatrists in Hong Kong, and according to the WHO's recommended ratio, there should be one psychiatrist per 10,000 in the population. So that means we're short of 260 psychiatrists. I support Ms. Lillian KWOK's amendment, and that is we should leverage on professionals in the counseling profession, art therapy and family therapy and so on. A more proactive approach should be taken to reach out to the community and identify those at risk instead of passively waiting for them to join the queue. The KWOK School of Medicine recently developed a mobile app using AI. The app can analyze the facial expression, the tone of voice, etc., to identify possible patients. Now, the accuracy rate is up to 80%. We should work with research institutions and universities in the future so as to develop more user-oriented apps. Using these as a platform, we can enhance the community network, and we should further develop AI analytics as tools for addressing emotional problems. Many are of the view that mental problems may be family related, so we can make use of DNA analysis to identify possible patients. This should be our priority in the future. Finally, I hope that there will be positivity in our population so that we can be resilient against problems. There are always solutions to problems. I support the motion and the amendments. Mr. Bill Tang. I thank Ms. Hon Lam for moving this motion on reviewing Hong Kong's mental health policy. I'd like to share a number of points with you. First, according to data, in 2018, 56,000 people were diagnosed with depression, and in 2022 the figure increased to 66,000, so that's a 17.6% increase. So that's only about depression cases. The 17.6% increase is really staggering, and we have not even taken into account patients who are in the queue for psychiatric services and those who have yet to enter the healthcare system. So if we are short of psychiatrists and psychiatric nurses, we should expand our mental health team of professionals. So my take is that there should be consolidation of healthcare manpower. In other words, is it possible to include more categories of professionals in our teams? Now, of course, the psychiatric nurses receive special training, but as a registered social worker, I know that we do not have special training for community nurses or psychiatric nurses, and this is far from ideal. In the ICCMWs, we do not have any social workers specialized in psychiatry. Now, Ms. Lillian KWOK has been championing the development of the counseling profession, especially since the 1990s. We have begun to see school counselors providing counseling services to students. And recently, we've also seen different streams and schools of the counseling profession, such as family therapists, so on and so forth. All these are ways to help those with mental health needs. And these are professionals that can help lessen the burden of psychiatrists and psychiatric nurses. So what is important at this moment is that we consolidate the teams and revamp the structure of manpower. We should make sure appropriate services are delivered to the right target. There is a lack of accreditation system for counselors and therapists. So the government should make a bolder move on revamping the healthcare manpower structure. Next, I am concerned about dementia. Patients suffering from dementia pose a very heavy burden not only on the families and the people around them, but also the community as a whole. A lot of resources are required to take care of somebody suffering from dementia. They may need a bigger space, for example. So for an elderly exhibiting depression symptoms, comparing to the elderly not suffering from depression, they are 30% more likely to have dementia as well. As we all know, depression is curable, but not dementia. We can only delay the onset and deterioration. So it is important to safeguard the mental health of the elderly as well. I hope that this debate will have the support of members and that the government will respond to the points raised by members. Mr. Tang Fei. President, I speak in support of the motion moved by Ms. Lam So-wai and the amendments by other members. On mental health, we need to be aware of a very important point, and that is students' mental health. Apart from the saying that prevention is better than cure, we need to show more care for the mental well-being of students, so that after they enter adulthood, there would be a lesser chance of them having mental problems. We have school psychologists and psychiatrists, and they have been making a lot of efforts. And we also have codes of practice and also other mechanisms established, such as the 3-tier emergency response mechanism. Now, these mechanisms are established drawing on previous experience, so I appreciate the government's efforts, but I'd like to point out one blind spot, and that is social media, the internet, they are developing in leaps and bounds, and they pose a very great challenge to the mental well-being of young people. In terms of applied research, I think Hong Kong is lagging behind. It is not sufficient just to rely on the experience of teachers and school psychologists. Noah Haraway, a famous Jewish scholar, once said that social media are now becoming an emerging weapon that may pose a major threat to the mental health of the global population. This may be a bit of an exaggeration, but still, for those not born in the era of the internet, it's really beyond our imagination. Take China as an example. The Advisory Committee on Student Mental Health held the first meeting on the 21st of February, and the government official said the following: this advisory committee should conduct scientific and territory-wide research and draw up indicators. More importantly, the relevant experts in the mainland should develop psychological health assessment tools for the students in the country, with an emphasis on safeguarding the mental well-being of students in the digital age. So, developing a psychological assessment tool for the young people in the mainland is something important. And starting from 2018, the youth cadre of the Communist Party of China and the relevant organization have been conducting a comprehensive survey on the use of the internet by parents and students in 31 provinces. This is a major survey, and Hong Kong should also follow suit. There should be a major survey in Hong Kong as well. In 1986, the famous psychologist Goldberg in New York advocated a survey called IAD, and that is the impact of the development of internet on adults and the possible addiction to the internet. In fact, many surveys have been conducted covering millions of respondents, and over 14 to 15% of secondary students have exhibited signs of addiction to the internet. The American Psychological Health Association have identified 7 major symptoms of internet addiction. So similar studies tailor-made for Hong Kong and the mainland situation should also be developed. We should leverage on the professionalism of counselors and psychologists in Hong Kong. We should develop our own tools of assessment. We should also make sure that the tools are incorporated in the codes of practice of frontline personnel.
多謝主席。
Dr. David Lam. Thank you, President. I speak in support of Ms. Hon Lam's motion on reviewing Hong Kong's mental health policy, as well as amendments moved by Ms. Lillian KWOK, Mr. Pui-leung, and Ms. Dr. Hoey Simon Lee. The community is attaching more and more importance to mental health, and the government is developing services on this front. In 2017, we established this advisory committee on mental health. This has become a milestone on the development of mental health policy, and they have developed a website which is a good gateway for people to seek help. Through Shall We Talk website, people have been criticizing that the cases reported to the program has not been followed up on, and they said that the website is not as useful. I think that if government dedicated more resources on following up cases that will help more people in need. Also, the mental health support hotline only offer referral services and they don't follow up on cases. I'm glad to know that the pilot scheme on assessment in DHLC, it will be implemented in the third quarter this year. This will help us in helping the people in need in a more timely manner. Mental health service goes from prevention, specialist treatment, inpatient services, recovery, and reintegration into community. We need the collaboration among the community, the healthcare sector, and the government. Teachers, social workers, and other stakeholders will have to form a primary healthcare network. Hospitals, as well as community, are also essential in this area. Very often, when we realize that people around us suffer from mental disorders, they are the ones teaching their parents and their social workers. So we need to train them in terms of mental health emergency response services. I hope that we can expand such training to schools. President, I'm glad to know that the government have dedicated much resources on developing mental health services. I know that we don't have enough psychiatrists. This is mentioned by other members as well, but I realized recently that most students actually opt for psychiatry programs. When I went to Pui-leung Hospital, I came across young doctors who were very intelligent, and I believe that they're elites of their class. And the government have increased the number of managers and lower the ratios of case manager to patients. When can we have the ideal ratio in place, and when will we implement a community treatment order? I think that if we can do that, this will be very beneficial to people in mental recovery. Without mental health, there is no health. I hope that we can develop a comprehensive mental health service. Thank you, President. Dr. Chow-man Kwong. The mental health conditions of Hong Kong people is one of the major issues that we have. Over the past 10 months, we have 51,000 new cases in public hospital. The median waiting time is 99 weeks. This is government figures. If you look at different age groups in 2023-24, the HA has 260,000 psychiatric patients, and they have 46,000 patients aged under 18. The two together will add up to 360,000. And there are 14.5% suicide rates in Hong Kong, which is very high. All these figures make us rethink about our mental health policy, and we should review on it. With the effort of different policy bureaus, we have rolled out different policies and measures, but objective figures show us that the situation leaves a lot to be desired. So I support the original motion and the amendments, and I have 4 suggestions to make. First of all, in terms of psychiatric patients and people with mental health disorders, for them to receive treatment, if they have to wait a long time, that will delay their recovery. So I think we should step up public and private partnership to shorten the waiting time and increase manpower. Figures show that in 2023-24, there are only 403 psychiatrists in the public hospital. The ratio is 1 to 744 between psychiatrists to patients, which is far lower than the WHO standards. Patients told me that they could only see a doctor for a few months when they went for consultation. or few seconds when they went to, or minutes when they went to the see the doctors, and most of the time the doctor only looked at their monitor. And a psychiatrist had a very difficult time when they practice, and very often they would opt for the private sector because they were faced with immense pressure. So I have two suggestions. First, we have to for young people who have been on the waiting list for a few months, we should give them medical voucher so that they can go for private services. This may involve additional expenditure, but that can alleviate the social problems that we have and lower our long-term medical expenditure. Second, we should learn from Australia to train general doctors to provide psychiatric services. We can train doctors in the A&E department on psychiatric services. Instead of referring all these patients to psychiatric SOP, this will safeguard our public safety. In terms of mental health of young and adolescents, I think that apart from psychiatrists, we should enhance their training and resources for social workers and psychologists to solve the problems. Over the past 5 years, there were 126 suicide cases among students. Male to female ratio is 1:1. There are 9% of students who committed suicide below 12 and some 5% for students above 12. According to the Education Bureau's statistics, each educational psychologist have to serve 6 to 8 schools, and according to UGC figures, there are only 16 to 40 psychiatrists who graduate per year. So we should subvent the UGC-funded universities to open more such psychology programs so that each psychologist can serve only 1 to 2 schools to improve the situation. My last point, we have to learn about our overall mental health situation. We can make good use of the I Am Smart application that have the 26 million registrants, or 2.6 million registrants, so that a government will accord more priority to the mental health conditions of our people. Professor Priscilla Leung. President, the motion debate on reviewing Hong Kong's mental health policy moved by Ms. Hon Lam comes at a very great time. I think that mental health problems is a ticking time bomb in our community. In terms of mental health problems in Hong Kong, it's been deteriorating due to various reasons. But first of all, in 2019, we had a social disturbance, and a lot of people suffered from depression, and they had much disputes with their family. And after that, we have 3 years of COVID, and with the rapid development of the internet, a lot of young people actually live and grow up in the virtual world. They can't even tell the difference between the imaginary world and the real world. I talked to a Taiwanese psychologist. They pointed out that there would be tragedies happening because of that. Because of young people delete a person in a game whenever they want to, and they stab people in MTR indiscriminately because they wanted to delete people. And there was a son who stabbed their parents, and their parents actually supported the son to study in Australia, and the son didn't realize that it's painful to be stabbed, and that was very staggering. So I think that we have to prevent and intervene early. And according to Hong Kong statistics in 2022, 25% of the interviewees didn't have a very great mental health. And we have a lot of hidden cases in the community. For people aged above 16, they were baby boomers. Half of our population actually grew up in the public rental housing estates, and they had a social life. This group of people have gone old, and I think that we should leverage on their power so that they will not become hidden cases when they retire. Because when they retire, they're used to working, and when they retire, they have nothing to do. And I think that we should listen to them. We have to talk to people. We should dedicate resources to help these retirees. Some of them are professionals. They are successful. Maybe you can ask them to share with young people their experience. Because our young people grew up very differently. And for people living in PRH estates these days, they grew up playing Game Boys, and they communicate with their friends via mobile phones. So we cannot use our own set of standards to look at the young people today. I think that we have to diversify our therapy services. So apart from the traditional public-private partnership, we should go into the community, and we should develop art therapy, music therapy, animal therapy. A lot of young people actually like animals, and perhaps we should also use this social worker therapy. If we ask people to become social workers, they actually will heal. And also, we lack enough people to listen to this group of mental health patients and ethnic minorities. We have some 1 million ethnic minorities in Hong Kong. And Healthy China 2030, we saw that the mainland does recognize such a problem because they have a one-child policy. So they attach a lot of importance to this issue. I have to stress again that mental health issues is a ticking time bomb of Hong Kong. We have to dedicate resources of manpower, financial, and we have to make leverage on a group of people to help others. I so submit.
Dr. Tik Shi-yun, Deputy President. From the figures, we can see that there is a mental health problem in Hong Kong. Last year, we had a record high with the number of students who have committed suicide. And in a survey, 30% of the respondents who are students have expressed that they have mental health issues. And according to a ranking of the UN, we are ranking 86. We are lower than mainland China and Taiwan. With the mental health issue, the government has long been passive. Whenever there are tragedies that happened, the government would then take action, set up a working group, and the measures that they take would just be a band-aid approach that does not tackle the root cause of the issue. We need continuous improvement with the mental health policy. I suggest that we should have a high-level public official to lead a task force to continuously review the mental health situation in Hong Kong. Undeniably, right now, different departments have done something about mental health policies, but then we do not have good coordination. Thus, we do not have a comprehensive support network. For example, the three-tiered emergency mechanism of the Education Bureau would have different stakeholders work together to identify the high-risk families and individuals. 2. Right now, with the mental health issue, we have the healthcare, social welfare, and education sectors working together. if we ensure there is good coordination, we can definitely help the patients in need, but we also need case measures to follow up on the specific cases. We also need to enhance awareness of the public to make sure they realize the importance of mental health. Early identification and collaboration between the three sectors I mentioned, as well as public education, are very important, and I mentioned this multiple times. It's just the fact that the government lacked the determination to do something. Apart from personal and family factors, the society atmosphere would also affect how people think. We need to be motivated. We need to maintain the spirit of the Lion Rock. But now it is not advocated as much. People have lost confidence, especially the youngsters. We would often say advancing from stability to prosperity, but then we have yet to grasp how the government is planning to make Hong Kong more prosperous. We do not see the government have comprehensive plans to make Hong Kong much more prosperous. In fact, I talked to a youngster. They do not know what the government is doing to make Hong Kong prosperous either. In fact, many citizens of Hong Kong would think that we have limited freedom and there is limited participation in politics. Under the national security law, people would avoid talking about politics and not watch the news. In fact, with the improved systems in politics, there has been less participation from actual citizens of Hong Kong, and people get depressed in the process. Such negative energy would affect mental health of the people. So the government should strive hard to engage the public and allow further participation by the public and allow those with different views to speak. President, I so submit, speaking in support of the motion. Mr. Louis Leung. Deputy President. We had recently many incidents that would cause public concern. Apart from persons in mental recovery hurting people, we also had a higher number of student suicides. There are also carers who were worried that they could not care for the ones they cared for. They would murder those that they cared for and commit suicides. In fact, we also saw incidents where parents hurt their children due to pressure. These are all warning signs that tell us that we have a mental health issue in Hong Kong. After 3 years of pandemic, people's living habits have changed. For example, students took online classes during the pandemic and have lost the adaptation to school life. And they face great pressure for this. And many parents have to work long hours. This has also caused great pressure for people. The government services for carers all along focused on taking care of the elderly persons and disabled persons. There's limited support for carers. All along, the government said that their health policy would be the adoption of a comprehensive approach promoting mental health instead of just treating people. We need to have prevention and early identification in order to intervene early on to provide the necessary services for people in need. Last June, we had the Diamond Hill stabbings. Very soon after that, the government has proposed 10 measures to improve the mental health policy to provide better support to those assistance in mental recovery. And in October of last year, 18111 hotline was launched to provide support and referral services for those with mental health needs. And in June of last year, the 3-tiered emergency mechanism was launched so as to consolidate the relevant services for students. We have in April the 4R, the mental health charter to enhance the resilience of students. So the government is not necessarily acting slowly, but they are just taking actions in response to incidents. There is no long-term planning in relation to mental health policy. Deputy President, today we are discussing mental health policies of Hong Kong. Without long-term planning, how can we review the policy concerned? So I urge the government to formulate long-term plans in relation to mental health policy and promulgate a roadmap if necessary. For example, setting the target number of psychiatric professionals and the number of training places needed. This would involve the work of Health Bureau, the LWB, the Social Welfare Department, and the Hospital Authority, etc. And right now, the Advisory Committee on Mental Health is only a consultative body. So I suggest the administration should set up a high-level cross-departmental task force to formulate mental health policies and allocate resources. Deputy President, we recently have the courtesy campaign for the tourism industry. With the promotion of mental health, we can also do more in order to urge other members of the public to provide assistance to those in need in order to create a caring community. I so submit, Deputy President. Mr. Kenneth Leung. Thank you, Deputy President. We have an increasing number of student suicides. Carers face great pressure. There is great public concern on the mental health of the people of Hong Kong. We need to ensure there is early identification and intervention in order to tackle this issue. We need the right policy support for this. I thank Ms. Lam So-wai for moving motion so that members can discuss this issue. Right now, for students, carers, and elderly persons, we have discussed much in relation to the mental health issues that they suffer. And it is suggested that we can work with NGOs to provide more support to the groups. But I am also concerned about the mental health needs of working parents. According to a study, there are many working parents who are suffering from great pressure. These parents need the support in mental health. Apart from them facing great pressure, we also see working youth face pressure. In fact, according to a study, over 40% of working youngsters are afraid of being stigmatized because they have mental health disorders, and many of them weren't willing to admit they had mental health disorders. In fact, it would take significant adjustment for youth to switch from a school setting to a work setting. We need to take into account the needs of such groups. With limited awareness, people are not willing to seek help. I recently dealt with a case. The couple is newly married. One of them was complained about and faced great pressure. They suffered from insomnia, felt like a worm was crawling on their skin, and they had to get admitted into hospital, and it was only in the Department of Psychiatry that they were identified to have an anxiety disorder. We need to eliminate the negative perception in society in relation to psychiatric patients to stop such incidents from happening. It was suggested that mental health services should be included in primary health care. This is good because we need to provide prevention instead of cure, because prevention is always better than cure. Right now, with the waiting time, we have every year 56,000 new cases. For the stable cases, they have to wait very long. We may miss the very golden opportunity to help those in need. In fact, for those living in the community, if they can access such services through primary health care, they can get such services sooner, and they can get those when they need them. We need to take a multi-pronged approach, remove the restrictions for people getting such services to improve mental health of Hong Kong. Deputy President, I so submit.
Dr. Dennis Lam. Thank you. Deputy President, now, it is very common for people to have mental health problems. It is not a rarity at all, and this is also the global trend. It is important that we draw up mental health policy as early as possible. To alleviate the burden on the public healthcare system, the government should increase healthcare manpower and comprehensively enhance the efficiency of the public psychiatric services. We should also explore the co-care model. We should review the operation of this model and enhance the efficiency, and it should also be expanded to cover new case bookings for psychiatric services so that another option can be offered to patients. Now, according to some psychiatrists, the amount of subsidy given to participating psychiatrists is on the low side. It's just $366, but they usually charge some $1,000 to $2,000 per session. The government should consider raising the amount of subsidy to participating psychiatrists so as to incentivize more psychiatrists to join the program, to shorten the queue on the public queue, and to benefit more patients. Community education, that's another important element. The government should collaborate with community organizations to mount public education and promote the information relating to mental and physical health so as to enhance the public understanding on mental health and to remove stigmatization and labels on those with mental health needs. The Equal Opportunities Commission this week published a set of guidelines on positive mental health for the media, and the media are encouraged to take an unbiased and objective stance and in reporting news relating to people with mental health needs in a bid to remove stigmatization so as to help these people reintegrate into society. The Department of Health also announced the annual health assessment survey for 2022 and 2023, and according to the findings, 4.1% of secondary and primary students had suicidal thoughts or attempted suicides, and for secondary students, this percentage was even higher. It's 5.3%. The Education Bureau has launched the 3-tier emergency mechanism. But apart from that, we need to show more care for students' mental health. Mr. Zhu KWOK has been championing positive education to enhance a sense of happiness in school campus, as well as cultivate positive values among students. I am supportive of this idea. We also need parents to work with us to promote mental health among students. So the government should step up education for parents to give more recognition to their children and to look after the psychological well-being of their children. I support the motion and the amendments. Does any other member wish to speak? If not, it's now 9:59. I will suspend the meeting for the time being, and then when we resume the meeting, I will invite Ms. Connie Lam to speak. The meeting will be suspended. The CE's Q&A interactive and exchange sessions will take place at 10:30, and the council meeting will resume right after that.